I'm Kelli Warner. When breast cancer is caught early, 5-year survival rates are 99%, according to the American Cancer Society. And researchers are learning more about this type of cancer every day. But breast cancer is not just one disease. It's different for each patient. That means treating it requires an individualized plan.
Stacia Pugh will never forget the day she was diagnosed with breast cancer.
It was very eye-opening and shocking. So it was 2 weeks after my 39th birthday, and I just was not expecting that at all.
This single mother of two was worried for herself and for her kids, but she dug in and got down to business.
Once I found out, my goal was, okay, how are we going to cure this? How am I going to get over this?
About 1 in 9 women in the U.S. will have breast cancer affect their life in some way.
Dr. Keith Wells, a medical oncologist with Willamette Valley Cancer Institute, says breast cancer is not the same for everyone.
Each individual's breast cancer is different, and it affects them in different ways. Where the breast cancer is, where it has spread to, how big it is, all of that plays a role into different treatment options.
Breast cancer is often treated with surgery, as well as chemotherapy, radiation, hormone therapy, or a combination of those treatments.
When breast cancers are evaluated in the pathology lab, then certain stains are put on them to look for the estrogen receptor and the progesterone receptor, as well as a protein called HER2. And whether the breast cancers express those receptors and proteins depends on what treatment we can give them.
Dr. Wells says women and men can take charge of their health by performing routine breast self-exams and report anything abnormal to their doctor. Also, talk with your healthcare provider about when you should begin routine mammograms. It may be recommended you start screening sooner if you have a family history of the disease.
If we detect a breast cancer early, we can treat it better.
Stacia has been cancer-free for nearly 3 years, and she's learned some important lessons since her diagnosis.
Advocate for yourself, trust the process, take one day at a time, celebrate the milestones. I learned how strong I am, and that it's going to take a lot more to knock me down.
Stacia's treatment included chemotherapy, surgery, and radiation. What helped her get through it was connecting with a mentor and attending a young cancer survivor support group. And she wants other patients to know that there are resources available to help them in a variety of ways. To learn more, head to OregonCancer.com. I'm Kelli Warner.